Hello everyone, this is your student nurse, J. Meraklan, and so now I'm going to perform cardiopulmonary resuscitation for newborn since the first thing that I will do since this is a newborn, we'll have to determine the upper score of a newborn. This method is a quick test done at 1 minute and 5 minutes. So after the baby is born, the first minute will tell us how the baby is tolerated and the birthing process, and 5 minutes as after scoring is tell us to how the baby is doing outside the womb of the mother. So now if the baby's upper score is 3, which is the concerning range, this means that the baby need immediate resuscitation. Um, After determining the upper score, we have to stimulate the baby respond by tapping the shoulders, rubbing or soles, and calling the name out loud. So, baby, baby, are you okay? Baby, baby, are you okay? So now, if there are no response, we will have to call out the cold blue or the doctor speak, so that the doctor or nurses will help us to revive the baby. Next, I'll open the baby's airway to have sanction the baby's mouth, and those using the suction mouth. So by doing this, this will help us to remove the suction that is obstructing the baby's airway. So after that, we have also to need to tilt the head of the baby and lift the chin of the baby, open further the airway. Have to lift the head of the baby and lift the chin. And now, since the baby did not respond, the stimulus we'll have to did a while ago that we have to perform the positive pressure ventilation of PPV. There are two types of could be through the invasive with the ventilator, and the non-invasive is the pediatric bag mask. So for this demo, we'll be utilizing the bag mask, then cover the baby's mouth and nose, and with the with it, well, the thumb of the forefinger of the one hand will be positioned in the end of the bag mask to secure the pressure seat, and the remaining finger will be positioned at the jawline of the baby. This is done that our hand avoid leaning from the baby's eye, to avoid the compressing of the baby's neck, and support the head. So to properly deliver the oxygen to the baby, be sure to maintain the proper using. What we're going to do is breath. So 2, 3 pump, 2, 3 breath, 2, 3 breath, 2, 3 breath, 2, 3 breath. And then PPV should be done for 30 seconds at the rate of 40 to 60 breath per minute. After doing that, someone will be attaching the heart monitor and a pulse oximeter to keep the track of the baby's heart rhythm, and the pulse oximeter will measure the hemoglobin, oxygen saturation, and will help to the monitor efficiency of the CPR. So if there are no increased heart rate, after the performing the PPV, proceed to the performing the chest compression. Since our patient is a baby, we can use 2 to 3 fingers, locate the lower half of the breastbone of the baby, and start the compression. But you can also do the two thumb technique, where you can put the thumb of the thoracic area of the baby and let your thumb rest of the center of the baby's chest, and start doing the compression. So this is the thumb. center of the chest of the baby. So as for this demo, using the 2-3 finger technique, and I am going to perform a 30 compression to rescue the breaths of the noting that chest compression should at one dip only since the baby bone isn't strong enough to handle strong pressure, and so we can also avoid harming the baby by puncturing the baby's rib. So now I'm going to doing the chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then give 2 breath breathing. 1, 2. Then repeat the chest compression. Continue doing for the at least 4 cycles, and if still no increase of the heart rate, I will have to continue doing the CPR and prepare to assess the intubation. This is where the doctor will insert the tube through the patient's mouth or nose and down to the trachea to keep the trachea open to allow the air pass through. However, if the baby's heart rate increase after the compression, the rescue breathing, then we can proceed to the post resuscitative care, wherein we could refer to the post resuscitative care algorithm. After the procedure, the end test that's need to be done, so we will know if the baby is fine and if the baby's body system is working. So through post resuscitative, we can monitor the administered oxygen concentration and the arterial oxygen saturation. So after doing that, everything in the procedure, we have the document the findings, the starting time of the procedure until the time ended, and respond the babies to the medication and treatment.